So Dr. Rose will be talking to us about health disparities and inequities, fact versus fiction, and potential solutions. Dr. Rose acquired her master's degree from Yale University and her doctorate from Teachers College, Columbia University. She has served as a faculty member from adjunct professor instructor to the associate professor level at the University of Miami, which is how we made our connection, at FIU, Springfield College, Worcester State College, Nova Southeastern College, Barry University, and Florida Atlantic University. She is currently the president and founder of her own firm, Rose Consulting. She's the author of several books, including Cultural Competency for Health Administration and Public Health, which was published by Jones and Bartlett Learning in 2011. Cultural Competency for the Health Professionals, for the Health Professions, published in 2013. And her newest text, released in 2016 by the same publisher, is welcome you on behalf of the Department of Otolaryngology, and we're all yours.
Thank you very much. I really appreciate it.
Really appreciate your thoughts and observations, and congratulations on having published those books.
Thank you.
There, a lot of the issues that you brought up are societal ones. We're a very subspecialty oriented department of physicians and other professionals, and surgeons and audiologists and speech therapists. So we all have very focused, areas where we practice. Can you give us some practical ways in which we can address issues of health disparities, sort of on a day-to-day basis? I understand ways that we can vote and do those sorts of things, but when we're seeing patients, perhaps be more culturally observant, or be thinking about some of the things that you said. But maybe there's some practical things you can talk to us about.
Yes, I think that's an excellent question. And I think that all of us in our lives are dealing with some kind of unique area of specialty. So I can appreciate what you're saying. And thank you for your compliments, by the way, about my books. I really do appreciate that, because it's been a great deal of work, and I'm very happy with the fruits of that labor, because I believe it's helping with this dialogue. But this is the issue. Even if you're dealing with a specialty that is very, very unique, and I do understand what your work is, it is also very important to hone in on some of these topics that I'm talking about on a broader basis, because the people that you are seeing that come to you for your care are individual human beings. And when they come into you for your care, they're coming into you with these social unjust factors on their back. They're coming to you with these factors in their head. They're coming to you with these factors in their bodies. And consequently, if your goal, no matter what your specialty is health for an individual, then it behooves you to try to understand the individual that you are communicating with. And that might be on a cultural basis, to try to understand their culture, to understand what kind of food they're eating, what kind of issues they're having. If they're having a language barrier issue, to be very, very sensitive to that. I have spent the past teaching in China at universities, the past 7 summers. And obviously I didn't get to go this summer because of what happened. But one of the things that I noticed was that when I walked into the classroom, all of the equipment and everything that I had to use was in Chinese, literally. So luckily I had a teaching assistant by my side at all times to help me with the process. But then I realized something. As I was talking to my Chinese students who understood English perfectly, there was a responsibility that I had. One responsibility was to learn how to say their names correctly. Another was to learn their language. Now, I know this sounds shocking, and I am not fluent in Chinese, but I then began to study Chinese for several years and literally take the International Chinese Language Test and learn how to write, how to pronounce their names, how to read Chinese, and so forth. Why would I do such a thing? I did this because I felt that even though I'm here to teach you specific subjects and I'm honing in on those subjects, you are human beings and you need for me, who is coming to you with my expertise, to at least try to understand your culture and who you are and how we will relate and conduct ourselves with each other. And I found that to be cultural respect. And it also led to my understanding that I had a language proficiency issue, that linguistically I was incompetent. And how can I come before you if you're the majority that I'm serving and dare to be incompetent? And so I found myself to be incompetent in that area, although I knew I was competent in the areas where I was teaching. So I believe that even if you do have a unique specialty, the practicality of it all is that you have a responsibility to try to understand and work with your patients on a cultural and linguistic basis, and to understand that they may be experiencing health disparities to a level that is deeper than the physical ailment that they're presenting to you.
I would just add to that. First of all, thanks again for a great talk this morning, and I really appreciated the focus on nutrition and the disparities there, because to follow on Dr. Talishi's comment, as somebody who takes care of cancer patients, we're seeing patients who are suffering the consequences of health disparities, particularly as it relates to nutrition and tobacco and alcohol, et cetera. And so in that sense, understanding how their care moving forward and how their chance of recovery and long-term quality of life and function relates to not only the consequence of how they got to us to begin with, but how we can help them through their health crisis is really critical. And it's not just cancer, it's salt relative to patients with Meniere's, and what is their diet going to be like when we talk to them about modifying their diet. And it's easy to say you've got to change habits, but if you don't understand the difficulty of changing those habits, I think we are limited in our effectiveness. So I really enjoyed the talk and appreciated those insights.
Well, I absolutely appreciate that comment, and thank you so much. And I do want to add to that, because this sensitivity, now I only chose food injustice so that everyone understands as one example of many, but a very pertinent example. I want to talk about that for a moment though, because one of the issues that I discuss in my book is food in terms of it not being habits per se, but being indoctrinated into the culture. So I appreciate so much what you said about habit, but let's think of this for a moment. You have an African-American person that you are caring for, and that person is eating something entitled soul food. And I'm not being stereotypical about this, because soul food is a part of many individuals' lives who are African-American and who perhaps their family members came from the South. That would have been the case for me. My mom was from Georgia. And so I grew up eating soul food, and it is so delicious, right? But I do want us to understand that that's not habit. I don't eat it as much anymore. I actually wrote a cookbook. It's called Effie's Soul Food Cookbook. My mom's name was Effie. Effie. And I modified all of her recipes in that book so that they are healthier, but without saying don't eat it. Why? Because soul food began during slavery. It was the refuse, it was the garbage food that was given to Black people who were brought over to this country as slaves. And the individuals in the quote unquote big house would throw away the garbage food and give that to the slaves. And the slaves then took that food and made it delicious and tasty, but it is the worst parts of the animals. It is the most coarsest of the vegetables. It is not the quality aspects of food. And you can compare this to what people eat in Africa as an example. I have traveled all over Africa. And what I noticed immediately is that African people on the continent are not eating what we call soul food here. They're eating remnants of colonization, yes, which was not part of their original diet. But for the most part, they're eating from the ground, they're eating from the earth, they're eating dishes that go back thousands of years. And African Americans are here eating something that has become a part of the culture, that is not habit, but part of who they are, who we are. And so to say to a patient, oh, just change that because what you're eating is not healthy, that's not acceptable. Because the seasoning that people are putting in food at such a heavy rate is because the food that they were eating was literally garbage. And so they were trying to season it up to make it taste good. And then there became sort of an indoctrination to that seasoning that got passed on from generation to generation to generation. So I have some wonderful quotes and research that has been done around this historical fact and how it impacted African American communities that I think it behooves doctors to understand. Because until you understand that it's not really so much about choice, but it's about who you are in terms of what your grandmother ate and your great grandmother, and what you passed on to your children and so forth. And if that's not broken somehow through health literacy, through education, it will continue. And we will continue to say, oh, Black people have higher levels of hypertension, and Black people get cancer at higher rates than other individuals, and et cetera. That's not accurate if we change these unjust factors. And then, of course, you don't have the foods that you need to go get in the stores in your neighborhood if you're poor. So even if you want to change, how do you go about doing it? So that's where we can help.
Dr. Rose, that was terrific.
Practical. Thank you. Thank you so much. Who am I speaking to now?
This is Simon Angel. I just wanted to mention, I love your insight on the food part. Let me bring a different factor. We investigated factors that affect the barriers to access to our pediatric services.
Yes.
And one important factor is the transportation, the distance to healthcare centers and the availability of transportation for the families to bring the children in.
Sure.
And it appears that our municipalities here in Southern Florida are not very interested in improving our public transportation on one hand, and on the other hand, the pandemic has really affected how people view public transportation as a way to, going to work or coming to a medical center. So I would like to hear your insight about it.
Yes, well, I think what you're referring to is access to care. And I think this is a tremendous issue. It goes back, I can't even believe that I'm still having the conversation about access to care, because when I was a public health student many, many years ago, this was one of the main issues that we were talking about. And sometimes individuals will say, well, politics is not really what I deal with because, I'm a doctor and I have to hone in and so forth. And I'm saying, no, you do deal with politics. Because if the doctors and other healthcare practitioners don't get in there and argue for transportation, then the patients are not going to get transportation. Because if we're dealing with individuals who are low socioeconomic status folks, when we talk about health disparities, and they're trying to function and get their day-to-day accomplished, and they have a child that is sick and they need to get to the doctor and they don't have transportation, this becomes a major, serious issue in their lives, adding already to the burdens that they are experiencing. So I hear what you're saying, and the solution often is that the healthcare facility itself has to come up with ways to provide transportation. I was the president and CEO of a community health center in New Jersey. These are federally qualified community health centers, as well as vice president of behavioral health services at one of the largest community health centers in this nation, which is located in Miami, the Jesse Trice Center for Community Health. And this was one of the problems that we also had. Transportation, how do we get our patients here? And that's why community health centers are often located in the community. Because in lower income communities, people need to oftentimes be able to walk to what they need. And if they can't walk to what they need, you have to go and get them. So that is the solution. And my experience at various health organizations has shown me that transportation and access to care is one of the unjust factors associated with health disparities. It has to be resolved.
Thank you.
It has to be.
Can I ask a question going back to food? Because we all love food. So
yes.
I'm a speech pathologist who works with patients who have swallowing problems. So that requires cultural understanding of what foods are critical to different cultures, particularly when you're going to ask someone to modify the consistency of a food. And for example, rice is a staple 3 meals a day. So related to that and related to something that you said about fast food.
Yes.
I believe you said that fast food was cheaper. And
yes.
I would like to question that, because fast food we know is ridiculously unhealthy. And I don't believe it's that less expensive than preparing a meal. I believe that it's quicker. It's popular because of fantastic advertising, you know, very catchy advertising. So kids really want to go there, and you can run right through. That's why it's fast. But is it truly less expensive than getting more nutritious food for a home and having it prepared at home? Or is it more of a time factor? And do we have an opportunity with the fast food industry to promote at similar prices healthier foods, healthier choices?
Okay, all of your questions are wonderful. So let me see if I can dig in there. First, let me say that in terms of fast food, it is cheaper. A family can feed their, a parent, a mother, a father, they can feed their entire family. I'm not going to say the names of any of these fast food industries, but they can go to these fast food locations and buy an entire meal for their family at much less than the cost of getting healthy produce that, first of all, has to be accessible to the families. And so we have to go back to access. If there isn't a quality grocery store in your neighborhood, that's number one. You cannot get fresh fruits and vegetables. You know, there is a piece that was done some time ago. It was on one of the news networks, CNN or whatever, and a reporter did research on the disparities in communities. And there were communities saying that it was easier for them to get a gun than it was to get fresh produce. Now, you know, that is a crime. It is sad. It is unfortunate, but it's a reality. So this assumption that folks can just have access to healthier foods is not true. And to promote in any way whatsoever that individuals choose fast food over the healthy food that others are having access to and getting is skirting around the problem and not dealing with it head on. Now, the fast food industry, can they help? Yes, yes, they can help. They need to be lobbied. They need to be communicated with. They need to be told that your profit incentive cannot be your priority over the health of human beings in the United States of America and throughout the world, by the way. As a person who has traveled to over 50 countries in this world, because a big part of my work is traveling, I see these fast food restaurants all over the world. And people who have been eating foods for thousands of years, healthy, beautiful foods, will then see their children being introduced to the fast food, and they begin to see obesity crop up and hypertension and diabetes and all of these factors. It's not because people want to necessarily eat fast food. It's because it's right there. It's available, like the liquor stores, like the cigarettes and everything else. So I recommend promoting as much as possible that people be able to get healthy foods, not processed foods, if we're going to reduce health disparities. It's imperative, even if it has to be changed, the consistency of the food. The priority would be to work with the patients to change healthy foods based on their culture and their diets, by the way, not to do so with processed foods and with fast food.
Dr. Rose, this is Merceline Anise. I just had a burning question.
Sure.
In your vast research and travels, have you seen, is there a relationship with the cost of healthcare and health disparities? And could you comment on that?
Yes, I believe there is a relationship between the cost of healthcare and health disparities, because it's kind of obvious on an economic basis. If we have more people that are sick, healthcare is going to be a big, big factor in our nation. And it's going to be very, very costly. But more importantly, I think I need to say this, and that is that healthcare is a business in the United States of America. It's a business. There's a profit bottom line incentive to the whole deal. And so as one who, as I mentioned before, served as the president, CEO, and vice president at community health centers, one of the things that we did every single day, especially as an administrator, was to monitor the bottom line. Our job was to make sure in a nonprofit situation that we were monitoring the bottom line, that we were making sure that we got additional funds. We spent a great deal of our time writing grants and getting money and so forth to ensure that patients could be taken care of. And if you look at our national healthcare system, and I use quote unquote for the system, the bottom line is that it is inordinately expensive for everyone. And that is because money is being made and people are sick, and we are not getting to the root causes, and we have health disparities. And those people who are sick and coming in for care, there's a word that we must consider here, and it's reimbursement. Their care is not free. Somebody's paying for it. Money is being made. And so we need to take the profit incentive out of medicine if we want to deal with health disparities. And until we do that, I don't know how we're going to change it, because we have to come to terms with that. As doctors, you are doing this because you care. My father was a surgeon, so I understand medicine on a level that is very personal. It is very important for us to understand that altruism was and should be and should always remain at the core of medicine, not money. And we have to be willing to say that without fear, without reservation, that we're not doing this because we want to make money off of your body. We're doing it because we want you to be healthy. And if we want you to be healthy, we have to look at all of the factors associated with what you're experiencing, not what you come to us with, which is the outcome of what is happening in our society.
Dr. Rose, thank you very much for this very insightful presentation. I think you gave all of us some food for thought. You know, those are ideas that I'm looking at differently now as a physician, and see how those impact my day-to-day interaction with patients. I appreciate very much you participating in Grand Rounds. Thank you for everyone who participated and asked questions. Have a good day, everyone.
Thank you all very much for having me. It was my pleasure. Truly it was.